Hi, good afternoon, Lydia and Michael. My name is Rich, and thank you for both joining the call today. Um, I'm a student nurse working for Kirkwood, and I'm here to discuss a little bit about Lydia's recent diagnosis of chronic kidney disease. Um, I definitely understand that this can be a little unnerving, but I'm here to help you try to understand what's happening and so we can manage it better.
Thank you so much. It's all been very overwhelming, and I have so many questions, and I don't have very many answers.
And that's understandable. It's perfectly okay. Let's just go ahead and start with the basics. So, chronic kidney disease, which I'll generally just refer to as CKD, it's much easier to to talk. So, CKD is a progressive condition in which your kidneys' abilities lose their ability to filter waste products and excess fluid out of our blood. Um, with CKD, the kidney's ability to filter these out of the body becomes less and less effective over time. And there are five stages of chronic kidney disease, from very mild damage in stage one all the way through end stage kidney disease in stage five, where treatments such as dialysis or a kidney transplant may become necessary. Your stage is also determined by what's known as the estimated glomerular filtration rate. Um, and we test that with as an EFGR test, which basically just measures how well your kidneys are working. I know that's a lot of medical jargon, but essentially we just test to see how well your kidneys are functioning at the time.
Okay, that makes sense. So my first question is, what stage is she currently at?
So at present, Lydia currently has stage three kidney disease, and this indicates that her kidney function is moderately decreased. And the point here is to try to focus on slowing its progress and managing any symptoms or complications that might arise.
Okay. What signs or symptoms should she expect?
So symptoms can vary from person to person. Some common ones include fatigue, changes in urination amount, color, even odor, um, possibly some dry skin, nausea, and we also see quite often swelling in the hands, legs, or feet, and sometimes even some lower back pain.
Oh, wow. What would cause something like this? And why is this happening to her?
So there are several risk factors for CKD. Two of the most prominent ones are diabetes and high blood pressure. These molecules, such as the sugar in your blood, are very big molecules, and the kidneys have a hard time processing those. So those can cause damage to the blood vessels and your kidneys, and this leads to damage of the tissues. Some other risk factors include obesity, family history of kidney disease, or even prolonged high fat levels of blood in the bloodstream. Um, and also a history of like an acute kidney injury can even lead to these long-term effects. And often it's a combination of these risk factors that lead to the condition.
So, is it something that's going to get better with time?
Unfortunately, CKD is progressive and irreversible. But with early treatment, I mean, we caught it early, and with early treatment and some lifestyle modifications, we may be able to slow its progress and manage its symptoms more effectively.
Okay. What kind of lifestyle changes would you recommend for her?
Great question. So I think a well-balanced diet is key here. Lydia, you should limit sodium, potassium, and phosphorus in your diet. Um, these because your kidneys are reduced in their ability to function, filter these out, excuse me. These can cause potentially adverse effects um, on your kidneys, heart, and bone health are truly important. Um, if you don't smoke, you should not start smoking. Avoid smoking altogether. And if you are diabetic or high risk of diabetes, you should definitely monitor your blood sugar And if it's outside the normal ranges, you also need to do something about it. Monitoring is not enough. We also have to take an intervention. Additionally, you should avoid certain over-the-counter things like non-steroidal anti-inflammatory drugs or NSAIDs. Um, these medications also may impair kidney function.
So what should I have to watch out for? What should I do? What do I have to do to call the doctor? Like what would have to happen?
So, some reasons that you might need to seek more immediate treatment in between visits would be um, there are certain things that can happen. So, for instance, I mentioned high levels of phosphate. Um, that may produce symptoms. Those might include tingling, muscle cramps, or spasms. Excessive calcium in the blood may also result in muscle weakness or confusion. If any of these occur, you should contact your provider or visit the nearest emergency department um, uh, pretty urgently, especially if these include persistent nausea, swelling, or changes to urination color, amount, or smell.
Mhm. I guess my next question would be, will she require any medications?
Yeah, again, medication management can vary depending on the individual. At the core of management are two classes of medications. They're antihypertensives and diuretics. Essentially, these medications help to manage conditions like high blood pressure and fluid retention. Um, you might also require medications to control your blood sugar or reduce protein loss in the urine. It's also essential to avoid any medications that could harm your kidneys, as we mentioned, like Tylenol, Aleve, for example. Over-the-counter antacids can also lead to a disruption in electrolyte imbalance. So make sure that all of your providers that you're seeing across the spectrum have a complete list of your prescription, over-the-counter medications, as well as supplements.
Wow, this just sounds like a lot. Like I don't know, what should I focus on first?
A kidney-friendly diet, taking prescribed medication as ordered, monitoring your symptoms, and remaining physically active are great steps forward. And I'll actually be providing you some kidney-friendly information at the end of the call.
That would be nice. How will she know if her condition is getting worse?
Yeah, so we're going to closely monitor Lydia's condition and gauge its progression. As I mentioned before, we'll run regular blood tests to measure her kidney function, as well as monitor for symptoms like increased swelling or fatigue that could indicate a worsening of her condition. And should any of those arise, we may need to make adjustments to her treatment plan.
So will I need dialysis or a transplant?
So these treatments are only necessary when you reach stage 5, kidney disease, which is known as kidney failure. Um, the goal here is to prevent or delay reaching that point altogether.
That makes sense. How long can you actually live with chronic kidney disease?
Yeah. So I can understand that the concern there with quality of life and uh, so progression of chronic kidney disease varies significantly from person to person, but with proper management, many people can live full lives for many years. And again, our focus is to delay its progression and try to prevent reaching stage 5 if possible.
Hmm. Okay.
Well, thank you for explaining everything. I feel more at ease knowing that there's a plan in place and I know more information.
Absolutely here to help. So I'd like to just say that, we are here for you every step of the way in managing this condition. So don't feel like you're alone in this
Thank you
journey.
so much. This has been really very helpful. Thank you.
Happy to hear it. Let's work together to keep you feeling your best, Lydia. And do you all have any further questions before we wrap up today?
I don't think so.
Mm, not that you think of.
Lydia?
Nope.
Okay, perfect. Well, again, like I mentioned, community resources that you may find beneficial. And in the meantime, don't hesitate to contact us with any further questions you might have in the meantime.
All right. Thank you.
All right. Thank you so much, Rich.
Thank you again for joining. Bye bye.